What if your eye looked perfectly healthy, but your vision was already changing? This educational content is provided by Dr. Narain, a leading expert in retinal and optic nerve care at South Bay Retina. When doctors evaluate optic nerve diseases like glaucoma, they look at two important things: how the eye looks and how vision actually works. And here's the surprising part. Those two things don't always change at the same time. Most people assume eye doctors can immediately see damage during an exam, but optic nerve conditions are often more subtle than that. Structural tests focus on the physical structure of the eye. They measure the thickness and shape of the optic nerve and retinal tissue. Think of structural testing like checking the engine of a car. Doctors are looking under the hood for signs of damage. Functional tests measure how well vision actually works. They evaluate side vision, light sensitivity, and patterns of vision loss. If structural testing checks the engine, functional testing is like taking the car for a drive. Here's where things get tricky. Sometimes vision changes happen before doctors see structural damage. Other times, doctors detect small structural changes before a patient notices any vision loss at all. That's why early optic nerve disease can be difficult to diagnose. A single test rarely tells the whole story. In glaucoma, optic nerve damage often develops slowly, and early changes may appear in either structural or functional tests first. Other optic nerve conditions may behave very differently. They can cause sudden functional vision loss or unusual patterns. That's why eye specialists combine multiple tests and monitor results over time. If your doctor recommends several eye tests, it doesn't mean something is wrong. Often it's simply to create a baseline for future comparison. By combining structural and functional testing, doctors gain a clearer picture of optic nerve health. The key takeaway: how the eye looks and how vision works are both essential for protecting sight. If you're concerned about glaucoma or optic nerve health, regular comprehensive eye exams can make a big difference. To learn more about retinal and optic nerve health, follow South Bay Retina for more educational insights.